Just want to read something. No cell phones or other noise-making devices are permitted during the meeting. Please silence those devices now. No clapping, applauding, heckling, or verbal outbursts in support or opposition to a speaker or his or her remarks will be permitted. Any person making offensive remarks will become unruly during the meeting, will be barred from further attending meetings, and may be subject to arrest. No signs or placards shall be allowed during the meeting. I'm going to do a roll call, and I'm going to turn the meeting over to our board chairman. Joe first. Albert Garcia.
Here.
David Galinsky.
Here.
Herb Lerner.
Here.
Eli Matrani.
Here.
David Lombardi. Jonathan Euromax on the call. I'm going to turn the meeting over now to our board chair, Joe first.
Thank you all for being here again. It's been some time since we last gathered. I will give a little introduction on who we are for those of you that are new to the audience. So we are the board of the Business Improvement District of Wynwood. We are a board of the City of Miami. We are elected officials, and we have been working tirelessly, not just during the Zika time, but previous to that, to try to improve Wynwood in all facets, from clean, safe, zoning, and general planning for this neighborhood. Of course, our attention and our focus has shifted. I'm very proud of what we've been able to accomplish in terms of trying to disseminate accurate information to our constituents and to the people of the City of Miami. And we're here today to talk about progress. We actually have good news to report, and I'm very honored, and we should all be honored to have Lillian Rivera here, who's the health administrator for the Florida Department of Health. And yesterday was a very troubling day for me. And for those of you that might have read the Miami Herald or other news outlets, you probably saw a headline that caused quite a scare. And the headline said, 4 new cases in Wynwood and 1 in Pinellas County. That was factually inaccurate. And Lillian is here today, and she was going to answer questions that Albert is going to direct to really disseminate the facts and the truth about what's happening here. We've been fighting an uphill battle as it relates to the releases coming out of the governor's office. You might have heard me say this before, but we're quite dissatisfied with the messaging coming out of the governor's office. The messages that are disseminated from that office have a tremendous impact on those of us in this district and those of us around the city and the county. So I'm going to turn it over to Albert to direct some questions to Dr. Rivera, and we'll go through that. We're also going to talk about some economic opportunities that we have, as well as get into the MANA SAP component towards the end of our program here. So, Albert.
Thank you, Joe. So before we begin, I'm just going to ask every board member just to introduce themselves for those of you that are new. I'm Albert Garcia, the Vice Chairman of the Wynwood BID.
Eli Matrani, member of the board, been in Wynwood since 1979.
David Polinsky, board member, Planning and Zoning Committee Chair, and a local developer in Wynwood.
George Warner, Wynwood board, a good board member. Family's been in here since the 60s.
And Joseph First, Chairman of the Wynwood Business Improvement District, Managing Director and Principal of Goldman Properties.
Terrific. So just right before we start, just by a show of hands, so Dr. Rivera can appreciate who's in the audience, aside from our friends in the press in the back. Can you just raise your hand if you are a business owner, property owner, obviously from the area, and obviously here to, very good, okay, so excellent. So Dr. Rivera, welcome officially to the Wynwood BID office. We've had the pleasure of, through these rough moments to, of course, get well acquainted with Dr. Rivera and her team. And they have been true partners. I want to make sure that's underscored. In the beginning, when this whole thing started, I think we can all agree between city, county, and state, the way this all started was a bit disjointed as far as communication and the response efforts, but particularly with the city and the county, and with Dr. Rivera's office in particular, there has been a dramatic improvement in the coordination and communication with the Wynwood BID, so I do want to acknowledge that and thank her again for coming today, because I know a lot of you were hoping to meet her last time we met, and she's been kind enough to join us today. So I know the question on everyone's mind is, can you speak to the news, to the recent developments that folks heard of, and can you help clarify and put into perspective what exactly has happened?
Sure, thank you so much, and thank you so much for the invitation. I really, truly think that one of the silver linings, if there's always a silver lining to a crisis, is that I've met all of you. I didn't know about you before, and I wish I did know, because I think I would have started right here, right when we were responding. But now I do know, and I actually know of the people in Miami Beach, because Tom introduced me to them, so we're going to be working with them very closely too as we respond in Miami Beach. Yes, the news yesterday was a little bit confusing, to say the least, and we really want to clarify, you do not have 4 new cases of Zika virus in this community. These folks were diagnosed in July, and those 4 new cases were in the pipeline. They were just, we were just waiting for some confirmation tests for dengue and chikungunya, which is always the practice when you're doing, when you're seeking Zika virus, you have to do additional testing to make sure it's not dengue or chikungunya, which, as you know, is also another arbovirus that we have in South Florida. So it's very important. So you do not. The last case that you have is the onset was August the 5th, so you really are going through that first incubation period that we're talking about. So knock on wood, right, that things continue this way we're going. But and today the report is going to say no cases when it comes out this afternoon. For Wynwood. I hope that clarifies. More clear than that, right? I was talking to Joe about this, that I don't know who puts the titles on the press. I guess it's a different person who writes the report, and another person writes the title of the article or the title of the press release, but sometimes it's very confusing. And remember what the State Surgeon General said, it's a process, right? These clients come to us, and there are different levels of investigation. You have to do an epidemiology investigation. You really have to go and ask a lot of questions, and you have to go through different levels of testing. So they go through a process. So they could sit in the pipeline for quite a while and not be known or declared a locally acquired case. And some of them at the end, we find out that they were not locally acquired because it was a travel case, right? So we have to make sure that we're very careful the way we're reporting this, because I think you took a step back yesterday with, saying that it was new cases, and it really wasn't.
Absolutely, like that. That's why we're excited to have the media present here today, because for those of you that aren't as intimately involved with the facts as we may be, I think it's an incredible disservice for blurbs to come out that are misinformed, especially for those of you that might have either seen or been a part of the Governor's Roundtable from Monday, when the State Surgeon General said very clearly that there have been no cases in the Wynwood area since the beginning of August, and then to have a press release come from the Governor's office that seemingly states something to the contrary is very frustrating for us as we try to get the accurate information and disseminate the truth and the facts, so that all of us in the Wynwood area can get back to business as usual, which is all that we want sitting up here behind this table.
So just to underscore again the headline, no new cases, right, Doctor?
No new cases. Yes, sir.
So, Doctor, can you speak to everything that's happening now as far as where we're at? We also heard yesterday that the zone that encompasses the 1 mile area that we're obviously a part of, along with the Midtown area, Edgewater, and the Design District, including Wynwood, of course, is also shrinking. So can you speak to the progress that we're making there, and what do you attribute that to recently as well?
Definitely our surveillance that goes along with the cases that we look at. And, we have been knocking door to door, and I do want to say that the Wynwood community has been extremely cooperative and welcoming to us in terms of cooperating us. It's not easy for us to knock on a door and say, listen, we're the health department and we want a urine sample from you, right? That's not an easy thing to do to anybody, but they have been extremely cooperative, all of the community, and they have given us the samples that we need in order to do exactly what you're saying, which is start then minimizing the box and making it smaller. So what we're waiting now is, obviously this is all decided by the State Surgeon General in conjunction with the CDC. As you know, we have a team here that has been deployed by Dr. Thomas Frieden, the CDC director, and between them they make the decision and advise the governor on how this box will keep on shrinking and shrinking and shrinking, and hopefully we'll get to the point where the advisory is lifted, right? but we still have a way to go. But hopefully, if things keep as they're going, and we don't get any additional cases, we'll be on the good path. Now, in the meantime, it's very important for us not to let our guards down. We're working very closely with mosquito control to make sure that your population of mosquitoes stays low. That up till now, I received a report this morning from them. As you know, they're working very, very closely with us, mosquito control, under the leadership of Carlos Jimenez and Alina Hulak, Deputy Mayor. And the mosquito control count has remained low, which is good news, right? We don't want it to go higher, so that's important. So the cooperation of the community when it comes to vector-borne diseases, and this applies everywhere. This applies in any country that has locally acquired cases. It's basically to look for breeding sites and make sure that we drain and cover, make sure that we don't have standing water, and make sure that the mosquitoes don't get a chance to breed, because then we'll have the mosquito population rise again, right? So in the meantime, it's important to protect ourselves. For those women who are pregnant or live here in the community, using repellent is very important, because at the end of the day, what happens with Zika, people need to understand this, that it's different from dengue and chikungunya and any other arbovirus like West Nile, is the fact that it does affect pregnant women and the unborn child, and that's why we're so cautious and so concerned about this. But you know, also the diseases that are mosquito-borne, it's a community effort. It really is. My family, my husband's family, and my family, my mom and dad, I'm from New York, I'm a New Yorker, okay. My family is from Puerto Rico, and you see what's happening in Puerto Rico, right? It's difficult, the situation they're going through. Because, you know, it's important. They have a tire situation in Puerto Rico where picking up tires and picking up, debris and all that stuff is a little bit difficult, but we need to cooperate and make sure that that doesn't happen here in Wynwood, and we keep our streets clean, our backyards clean, that we're not breeding mosquitoes, and we keep that population down, and we should be okay. I am very, very hopeful, right, that very soon this shall come to pass, and we will still have, you know, the threat of dengue, chikungunya, or we live in South Florida, folks, right? We have the mosquito. The mosquito will live here for us forever, forever. The reason the health department was formed, it was because of yellow fever. And that dates back to the time when Henry Flagler was building the railroad. And so we have mosquito Aedes aegypti to go all the way through. And it's very hard to eliminate it totally, but the mosquito count could go down if we make sure that we don't have breeding sites in the community.
Doctor, thank you for that answer. We understand that your office isn't responsible directly for the administration of the infamous box that now hovers over our area and parts of Miami Beach. But could you also speak from a larger perspective for South Florida, the false sense of security that may create for people who just think, well, as long as I'm outside of that box, I have nothing to worry about. Do you want to speak to that?
And this is something, as a public health official, and I share the fact, or I share the how can I say, the opinion, right, my professional opinion, that this mosquito is everywhere in South Florida, right? It's everywhere in Miami-Dade. It's not only here, that's for sure. It's everywhere. So we should be taking care of ourselves, especially the pregnant women, everywhere we live. It's not only within Wynwood, or it's not only within the beach. It's very important that we take care of ourselves and know that this mosquito is everywhere. It's east, west, right, north and south. It's everywhere. So we have to take care of ourselves. So this thing about the box is a very interesting argument. Obviously, we all work for somebody, and the box is determined to give us more, how can I say, emphasis in certain areas because the cases were there, but definitely everybody. And if you read the CDC advisory, it does say, point out 2 areas, but it does say that the whole area you should take care of yourself. It does say that, so we have to make sure that definitely happens. Don't give that sense of security that it's only here in Miami Beach. It's everywhere.
And we've been working tirelessly through the governor's office and CDC to try to get that box removed. We all know, everyone sitting in this room, that that box can be suffocating. We feel for our colleagues on Miami Beach who are now going through the same thing, through what I believe, again, is irresponsible, creating a crisis and a scare for people within the box and providing a false sense of security for people outside the box. So that's our opinion. We've been working to try to get that messaging through the media and obviously through the governor's office and the various public health offices to try to get these boxes removed and start really focusing on disseminating factual information about the disease and prevention of the disease, as opposed to an idea or policy of containment, which we all know is incredibly false and harmful to those that reside within the box.
So at this time, I want to open the floor to the board. If there's any questions here for Dr. Rivera, who I know also is eager to hear from all of you.
The Herald this morning, we mentioned as fall sets in and by November, mosquitoes are going to die off. I mean, is this the end of, as we know it, is it just for the season of the Zika virus, or is it going to, we have to do more as far as vaccinations or something in the future to really get rid of the Zika virus?
So that's a very good question. What is the future, right? The future for this new arbovirus or vector-borne disease by mosquito. In the future, we really want a vaccine. We don't have a vaccine. It's far out, right? It's not in our immediate reach. In the future, we would want a vaccine that would be available to women, right, in preconceptual stage. So if they do get pregnant, hopefully that will protect them against congenital anomalies, right, that babies are not born with problems. So that's one thing we want to see in the future. But that's going to be dependent on science. It's going to be dependent on dollars, right? And you know that our governor has advocated for the federal dollars to come. So that really, really needs to happen. Also, the federal dollars will allow us to have better diagnostics. You know, we really want to test some more people for Zika. Not only women that are pregnant we're testing for free right now, but we want to test men. We want to test anyone who feels that they have been exposed to the mosquito and to the disease that could be tested. So we need better diagnostics in public health. Right now we don't have that. So in the future, what happens with any mosquito-borne disease, in the winter, the mosquitoes tend to go dormant, right? They tend to go dormant. I'm not a mosquito entomologist specialist, but I've heard them say plenty of times that during that time the mosquitoes really just go away, right? And then the larvae is left until the next heat wave or the next summer comes up. So that might happen, so you're going to see that. But we all have to recognize that Zika has entered the continental United States. It's here, and like dengue, like chikungunya, we could have future outbreaks of it, you know, based on what the scientists are telling us. So it's not that it's going to go away forever, but it might go away in the immediate future and then come back.
We heard in the media that in the first week following the original Zika event, that the majority of the cases, maybe all of the cases, were concentrated within a 500 by 500 foot area. Our last board meeting, we asked specifically what that was, but we're told that there couldn't be disclosure for HEPA and privacy reasons, which we respect. But my question would be, it really has two parts. One is to ask you to confirm if it's still true that the majority or all of the cases in Wynwood that were actively transmitted were in this small 500 by 500 area. And the second part is, if it's true, when can we expect that that part of the district will be declared Zika-free? Because it seems like a lot of effort should be focused on clearing the risk from that area.
So yes, you're right. There are some things that I definitely cannot declare. This is an active investigation, and so we can't. At some point, maybe in the future, when things become public, you'll be able to know more about the origins and all of that. So let me start by saying that the CDC looks at the latest onset of disease, and they count 45 days, which is 3 incubation periods. Okay? So if August 5th, you add to that, you more or less get your time that we're going to be okay.
But specifically, the question was, is there a particular focus on this 500 by 500 area?
It's just
Because
that
the
the
areas
box,
that have been
the box
cleared-
that's left.
The box that's left, so the box has been reduced in size based on clearing areas at the periphery of the box.
Which
That's
no activity was
and
found.
that's a wonderful thing. So I guess if I'm interpreting what you're saying correctly, is that hottest of hot zones will be clear when 45 days have passed with no transmission.
That's correct.
Okay.
I understand there was a certain amount of boxes that were put out for traps. They had a minimum amount. Are you still putting the straps out? To see?
Yes, they are out, yes. And the mosquito control is not here with me today. Unfortunately, they couldn't make it, but I did check with them this morning, and the traps that are out are minimum amount of mosquitoes that are being trapped. Yes.
I understand they all came back negative. I don't know if they increased
Yes,
the amount of
there
traps.
is no trap that has been positive. That is correct.
So, Dr. Rivera, just moving forward to help manage the information or at least put perspective into the data, because we know your office is constantly updating not just what's happening here, but throughout the state of Florida.
Yes.
And there's obviously multiple agencies and departments and counties and obviously the state involved in ensuring that information gets out. For the public, what's the best place to find that information and also to, again, not fall into the same trap of getting into a sense of confusion as to what the true numbers are, what are the new numbers versus what are the running tallies of active investigations at a later date get confirmed. Moving forward, what would you recommend the public do and of course the bid?
We do put out a report every single day. It's called the Daily Zika Report, and it could be found at floridadepartmentofhealth.com. And they do tell you, explain to you the active investigations, and they tell you the amount of cases at the state and so forth. We are looking at ways of improving that. With your recommendations, we have made already significant improvements to the report, so I thank you for that, because having clarity for people to understand what's out there, since every case is a process, every case needs to be looked at individually from an epidemiology standpoint, that is your best source of information. And the report comes out on a regular basis during the afternoon. Now, yesterday there was, it came out a little bit late last night, but irregularly it does come out in the afternoon, and it is posted on that website so you can see it. It gives you all the cases from around the state of what's happening in terms of travel, right? And it does talk to you also about the locally acquired cases. Now, you did see the news that there is a case in Pinellas County that's being investigated, right? A person of interest there. And that's about it right now. Today there might be the report coming out this afternoon.
It's out.
It's out already?
Palm Beach County.
Okay, just came out, okay. So a case in Palm Beach County, that there's also another person of interest there. So as you see, the state uses a very sophisticated system, and we every night get together and look at all the cases that pertain to Miami-Dade and make sure that we have a complete understanding of how it's happening. Many of the cases I've done myself, the EPI investigation, because I want to make sure that I get the information right in the language from the people and make sure we talk about everything. We talk about the sexual history, we talk about where they traveled, we talked about possibilities of other places that they've been to. So we are very, very thorough in what we do. And sometimes we go back again because we want to make sure that we don't attribute a case to some place and that case should not be attributed to it. So that's very important, along with the laboratory findings. That's extremely important. So I hope, yes.
So we know that you're short on time,
Yes,
and I
yes,
want to
I
thank
have
you
to.
again for coming, but I do want to give just a brief moment, maybe for one or two questions, if there are any from the public or from the press that's here today. Just that Dr. Rivera can speak to that.
Yes, sir.
Thank you, ma'am.
You're
Happy you
welcome.
came out to help inform us everything, and I'd like to also congratulate the PID on a great job of doing, finally getting us the working community information that we needed. I want to just bring up 2 points if I may.
Sure.
Now that it seems like we're kind of getting the Zika thing under control. I want to address another problem that's ongoing that doesn't seem to really be totally addressed. I know Metro Dade, just the other day in their meeting, said that they will no longer be doing spraying during the week when children are present. They now said that yes, maybe they'll be doing it on weekends. We're still dealing with a toxic mallet that's being sprayed over residential areas, and my people in my constituents that are supporting this feel that it's not really being addressed. And are you going to continue to spray mallet during this area when we're finding that the BTI is far more effective, and there seems to be other things like boots on the ground, emptying the water, which all seems to be a viable way of dealing with this. You had mentioned earlier that you were from Puerto Rico.
Yes.
And you're aware that it was banned in Puerto Rico, so they're no longer spraying it. I'd like to get your input on that, and as well, how you feel about educating everybody here about actual Zika when you contract it. If you're not a pregnant woman, everybody makes it sound like it's a plague, but from what I understand, it's more associated about having a cold and having some symptoms, and then once your body produces antibodies, it's no longer in your system.
Let me start with the latter. Okay, so Zika definitely is a virus that we're getting to know a little bit about, right? It just presented itself in Brazil not even 2 years ago. So we're learning a lot about Zika and the effects on different types of population. We are learning more and more about the pregnant women, and again, we do have science that tells us that there's a direct relationship of Zika with the unborn if the baby does acquire Zika while in the womb. So that's, we're worried about that. But you're right, 80% of the people that do suffer from Zika or get Zika basically don't have any symptoms at all. And the people who do have symptoms, they do overcome those symptoms, right? Now there is a syndrome which is called Guillain-Barré syndrome. We haven't seen that in Florida. We've only had one registered case. But in Puerto Rico, they've had around 30-plus cases of Guillain-Barré, which is also a concerning type of response, and that was in adults. So again, Zika, we don't know enough, and you're right. If you get it, the science is telling us that you're immune and you won't get it again. But again, that's out to be judged still. We don't know. We don't know enough about that. But again, so does that answer your question about Zika? In Zika, you get rash. You could get a rash, you could get conjunctivitis, you could get a fever, right? Also pain in your joints, that's another symptom. Those are usually the four classical symptoms. Some people get one, or some people get 2 symptoms. They don't get all of the symptoms, so that covers that. In terms of the spraying and the aerial spraying and so forth, I'm not an expert on that. I really have to let my folks in the Poison Control Center and so forth answer those questions, and the mosquito control. We from the Department of Health, there is a special section that specializes in that area of the spraying, so I'm sorry, I'm going to have to get back to you on that one, but I know there's some community meetings coming up that will be addressing that, and the Poison Control Center will be helping us with that. But I will take this back to the leadership of mosquito control and the people who are working in that area. If
I'd love to
that's
see
okay.
the BID maybe respond to that, and see if she's going to give you this information to include that to the rest of the business community.
You have our commitment.
Because it is a neurotoxic poison and it's still being dropped. If they're saying they're not going to drop it on kids during the week, why would you even continue to keep doing it in the district? It's not that effective.
So we will get the information,
Yeah.
we'll relay it to you, we'll make that
Make
part
sure
of
that you
our
get
press releases that I'm sure that you're getting in our daily.
We do have a meeting with Regalado, the mayor, on Thursday, and I was hoping to get a comment from you, so I could have, or from someone, maybe from you guys, whether you're going to support this, to stop spraying in Miami or not. And if you could address that as well before we get into our meeting on Thursday, that would be great.
I know there'll be representatives from the Poison Control Center at the event with you on Thursday. I've heard about that, so they're going to be there to address some of the concerns.
Thank you very much.
Yes, sir.
Okay, just one last question.
Doctora, buenas tardes. Tengo una pregunta para usted. Ayer, uno de los candidatos, Alfred Santamaría, estaba caminando por Wynwood entregando un medicamento que se llama Zika Zen. ¿Había escuchado de eso? ¿Se había escuchado del medicamento? Si es verdad que neutraliza el Zika, porque de acuerdo a su volante dice: y haremos donaciones de un nuevo medicamento que previene los efectos del virus.
Before you answer that question, because we're in our ward of the city, could you also repeat that question in English, or if somebody could translate for you?
No, I can
so everybody in
translate.
the audience can
Yeah.
understand what you just asked.
One of the mayoral candidates yesterday was walking around Wynwood giving out vials or little bottles of this medication called the Zika Zen, and they basically said that it neutralizes the Zika virus. So I wanted you to know if you've heard about that, if you've heard about the medication, or if this is true. I wanted to clarify that because it has become very controversial.
It has?
Yes.
Okay, okay. Let me see how I can, I know about it. I know
Si
exactly.
puede empezar en español, se lo voy a agradecer.
O sea, yo sé lo que pasó ayer. Okay, sé exactamente lo que pasó ayer. Y le voy a decir que no hay ningún medicamento en estos momentos para el Zika. Ningún medicamento. No existe ningún medicamento. Ninguno.
¿Considera usted que eso es peligroso? Porque entregaron bastantes ayer por la zona de Wynwood y las personas pensaban, le estaban diciendo, básicamente lo que estaban diciendo, and I'm sorry guys, le picaba un mosquito y después que le picaba el mosquito se echaba el virus. Basically what they were saying is that the mosquito stings you, that you could rub that medication and then it would, I guess, kill the protein.
Well, let me tell you that I don't think that was the appropriate thing to say or do. To hand out a medication and to say that we have a medication for Zika is absolutely inappropriate. And I would, I don't know the gentleman, I don't know who he is, but I would definitely recommend that he stop and desist from doing that immediately.
¿Te puede repetir eso en español?
Por favor, que le pido al señor candidato a la alcaldía que por favor no siga repartiendo eso como una cura para el Zika. Si lo estoy interpretando bien, él está diciendo que es cura, o él está
Dicen
diciendo
que
que es un remedio.
neutraliza, es un remedio.
Que es un remedio.
Thank you.
Yeah, so-
Thank you.
Thank you, Dr. Rivera. So thank you very much again. We really appreciate it, and want to thank you again for coming out today. and
Yes,
being so helpful.
you're welcome. Can I just say to you guys that you guys are in great hands. They are watching over your businesses, this group right here next to me. And we will get through this. We will be a better community. After this, we'll be more united. But please help us drain and cover in our community. It's very important because that mosquito population has to stay down, okay? Thank you, guys.
Thank you, Dr. Rivera. So our meeting continues. We now want to shift focus into the economic recovery portion of what's happening here. And I do want to acknowledge that when we met with Governor Rick Scott earlier this week, we discussed, thank you. We'll break, you guys can grab your cameras really quick.
Thunder and herd right out the door. They don't know that what comes next is more important to everybody here than this. Whoa, 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 miss.
Okay, just,
We're gonna continue the meeting, please.
all right, guys.
Guys, order.
Meeting is continued. All right, so while the press exits, the board meeting continues, so I just want to make sure that nobody thinks we're wrapping up. The state has heard from us time and again as it pertains to the economic recovery needs of the community. So we had the opportunity to meet with Governor Rick Scott earlier this week, and he has dispatched members from the Florida Department of Economic Opportunity who are here today. So I do want to acknowledge Samuel Hood. Could you just raise your hand really quick so people can...
Outside.
He's outside, okay. So he is here, and he is going to be sticking around to meet with each and every one of you, should you be interested in having a conversation with them. What they're doing right now is gathering information, canvassing the basics, trying to get a better handle on the economic impacts that your businesses have certainly had to weather these last few weeks. And with that being said, I just want to make sure everybody knows that we're still working on either a remedy plan, a recovery, monetary program that might be able to help you all in recovering some of the lost income, or at the very least, connect you with programs at the state that can help you with bridge loans and other financial programs so that you guys can stay in business, which is right now our primary focus after the health and safety pieces that we're obviously working on as well. So please make sure you see him and know that we are working together. And in our daily emails, if you have not been receiving them, make sure you're subscribed. See Tom after the meeting, because we will also circulate that information as well. So if you don't have time today, or you know of other businesses that aren't here that might be interested, be sure to share that information with them. So with that, I do want to turn it over now to my colleague. Oh, one more point out. Thank you, Tom. And Julio Beatty is here from Career Source, South Florida, and he's standing in the back with the purple tie. And you probably saw his large trailer out front, and he's here also to give information to your businesses, particularly if you have employees that either have recently been laid off, or you feel they might be at risk of being laid off, and you want to have support mechanisms in place in anticipation of that. We're also thinking a little bit ahead for them as well, understanding that this is a very complex situation for a lot of you. So those resources are here today. It doesn't mean they disappear after the end of the day. Tom and I and the board will continue to make those connections for you and for other businesses as we move forward. Any questions about?
Real quick, so does that mean we should not really pay attention to this because it's still
You should pay attention to it. You should pay attention to it because here's the most important part right now. It's important for the state, for the county, for the city to get a firm grasp, or at least an educated canvas on exactly the extent of the economic impact that we've been hit with. We've spoken to many of you individually and off the record. You've told us percentage-wise or revenue-wise what the hit has been like. And we've been conveying that information at a more broader level on behalf of the district. But in order for you all to eventually be eligible for any of these programs or potential new programs, it's important for them to know specifically what those damages have been. Typically, in a natural disaster, there's property damage, and then obviously that triggers loss of economic revenue. In this case, because of Zika, knock on wood, property has been pretty much intact, and it's really just the reaction to the news that has stunted a lot of business in the district. Folks that just aren't coming like they used to. So it's a little bit more difficult for them to put a dollar amount or a snapshot on that damage because the aerial perspective of damage from a hurricane, for example, doesn't speak the same as what we're going through here today. So they are going to ask you basic information, how long you've been in business, what was the decline year to date, for example, comparison to last year. If you're a new business and you don't have a full year's worth of data, they're certainly going to speak with you and see if there's monthly projections and trends that can also speak to the fact that this was obviously caused by Zika. And that's the Department of Economic Opportunity. So, and he is now standing in the back with the black jacket. So we are going to send out an email. We're going to relay that form, and that's where we encourage you all to fill it out, provide them with that information. It's shared with us here on the board, and we can then use that to lobby not just the state, but also the county. And we're working on other policy fronts as well to see if there's other job incentive packages that we can perhaps pursue at the county level to help businesses hire people as well as retain the staff they have today. We're limited on time, but if you want to say a brief remark.
I have 2 points. There's an online survey. That's the most rapid way to get us information on assessment. Also with them, they can relay that. And then the second point is, and you go to 40jobs.org to do that damage assessment. If you haven't done it, like I said, we don't get the tally, we don't know the need. Therefore, the feds or SBA, we don't know where to go and how to get there. Secondly, the STC, the short-time compensation, you do not need a declaration for that. That's available 365 days a year regardless if there's a disaster or not. So that program is available now. Thank you.
Okay. Julio, anything you want to add?
Just that we're here to help. Career Source South Florida, your local workforce board is here. So whether you're looking for employees, trying to keep them that you got, and programs to help you, we've got our mobile truck here today just to show you that we're mobile and you can reach us anytime.
Okay, terrific. Thank you, gentlemen. Thanks for coming out today. With that, I'm going to turn things over.